To kick us off this afternoon, we head over to Hillpark Hotel right here in Nairobi, whereby the Kenya Union of Clinical Officers are discussing matters regarding the welfare of clinical officers while battling the COVID-19 pandemic. Our reporter Carol Kamau is on standby. Carol, bring us to speed.
A very good afternoon to you, Jackie. Thank you so much for joining us. We're live from the Hillpark Hotel here in Nairobi, again staying with the welfare of health workers in Kenya amid rising cases of COVID-19 in the country. We'll start off on a very sober note today. Another healthcare worker has died just last night in KBC County. And at this point, I'll bring in the Kenya Union of Clinical Officers in the country, George Gibore, to just talk to us about that. Today, you've issued a 14-day strike notice. One of the issues that you've raised is the issue of vulnerable healthcare workers who are still working in the country despite, the regulations of WHO on the vulnerable members of society. Let's just start from there, Gibore, and thank you so much for joining us.
Okay, thank you very much, Carol, for having me. And I want to raise this issue, as you have said. Of course, we regret that we have lost one of us again today from KBC level 5. And the attributing factor that we have seen is an age issue, and we have been raising this issue all through. It should be remembered that on Sunday we were here, and we still insisted that the government need to consider to exempt these people who are vulnerable, the aged, those who are 50 and 55 above of age and above, those who are pregnant, those who have pre-existing condition, and also with other diseases must be exempted from the active duty. This will avoid actually unnecessary deaths that we are seeing. We have actually gone through to look at all those who have succumbed. Now we have lost this. This is the 7th one that we have lost due to this COVID. And we are saying that we will have avoided this because if the government heeded to our call to exempt this vulnerable group, because a majority of them are among the vulnerable group, they wouldn't have lost them. Then I need to say that today we were here to issue a strict notice after 7 days where we were here and call on the government to implement on a number of issues. So our irreducible minimum which we are asking the government is to ensure that they consider relieving or rather exempting those vulnerable groups from active duty. 2, they must be able to provide a comprehensive medical cover for the healthcare workers that can be able to cater even for the COVID-19 bills. The other issue is that we are asking the government to ensure that they are considering the clinical officer who are not getting any risk allowance to be given the risk allowance, and those who are getting the major 3,000 should be able to be harmonized to 20,000 at least. And similarly, we have said that we need PPEs, adequate PPEs to be provided to all health centers and health facilities so that we can be able to protect ourselves and protect Kenyans. Because what we realize is that once we have been exposed, it is easy to expose the people around you, your family, including the patient. So we have found that we do not have enough. Yesterday we had our ADC, and the ADC gave us a damning report where that they are struggling to get the PPEs, including just a surgical mask, which is now available to 99% of our facility. Very few isolation centers have N95, and the majority of them have surgical masks where they are used to use for actually 24 hours instead of 3 to 5 hours. So we have said if this is not provided, we will go on strike after 14 days. And that is the strike will begin on the 7th next month, and that's to mean if things are not done. But we remain available for the government to ensure that we resolve these issues. Those among other issues including payment of the UHC staff that have gone for 6 months now without pay. We are calling them to pay, including Vihiga, which have not paid healthcare workers for over 13 months, and we do not know what is the reason. We are calling on them to ensure that they are doing that. Carol.
George Gibore, thank you so much for that. We certainly will be having this conversation even further at 9 o'clock, just to talk about the issues that healthcare workers continue to face, and generally the issues that then Kenyans continue to face with your issues not being addressed. Asante sana Gibore for that.
Okay, thank you very much, Carol, I need to urge Kenyans to continue taking these issues seriously, wash their hands, and ensure that they are having social distance, and ensure that all the time they have the mask once they are in any public gathering. Thank you very much, Carol.
Thank you ever so much for your time.
Okay, thank you very much.
All right. So that's George Gibore speaking on behalf of clinical officers in the country. A 14-day strike notice has been issued unless the government meets their irreducible minimums. And you did hear him state what those are. We shall be escalating this conversation even further at 9 o'clock. So be sure to join us for that. Back to you, Wambiru, for now.
Well, that was our reporter Carol Kamau coming live from the Hillpark Hotel, whereby the Kenya Union of Clinical Officers have issued a 14-day strike notice, as well urging the government to ensure that health workers have access to PPEs. We shall be having that discussion later on in our subsequent bulletins. Now,